Right. Thank you. Thank you, everyone. Thank you for taking your time to attend this research seminar. So I'm Dr. Hamiza from Department of Surgery. I will present on the topic today is qualitative research in healthcare. So at the end of this talk, you'll be able to explain the purpose and benefits of qualitative research in healthcare, identify different qualitative research methodology used in healthcare setting, and understand basic qualitative data collection and analysis technique relevant to healthcare research. So this is John Creswell, the father of behavioral science research. So if you're very new to qualitative and maybe mixed methods, you can start exploring, start with his books. It's quite easy to understand, I think. So based on, according to John Creswell, the meaning of qualitative research is an inquiry process of understanding a social or human problem based on building a complex holistic picture formed with words, reporting detailed view of informants and conducted in a natural setting. So there are few keywords there. It's an inquiry process, which is understanding exploratory in nature. And the finding will be formed into words. And from the detailed view of informants, so your informant could be patients, participants, maybe clinicians, and it's conducted in natural settings. So there's nothing is controlled in qualitative research. So what is the key differences between qualitative and quantitative? So the qualitative usually try to understand the why and how, sometimes also what lah. And quantitative usually try to understand what and who. So in terms of concept, qualitative aims to understand human behavior from the perspective of the informants, and the reality is assumed as dynamic and negotiated. For quantitative, it aims to understand, discover the facts about social phenomena, and it believes that the reality is fixed and measurable. That's why it controls your maybe variables. In terms of methodology, qualitative data is collected usually through participant observation and interviews, and data are analyzed by teams and description by the informants and reported in the language of the informants. But for quantitative, data is collected through measuring things and analyzed through numerical comparison and statistical inference, and data are reported through statistical analysis. So what is the purpose of qualitative research? It's explore and understand the human aspect of health. Using qualitative research, you can understand patient experience, for example, their perceptions, feelings, and decisions in terms of health conditions, treatment options, and interactions. And you can also explore clinician experience, their perspective on their practice, for example, and interaction with patients. And also you can also explore the social and cultural factors. Usually in quantitative research, we use the questionnaire, for example. And questionnaire is the tool in quantitative research, and they are reflective. But however, for qualitative research, you can explore different aspects that may emerge from your interview. You can also explore the social and cultural context that influence certain behaviors and maybe healthcare access and treatment decisions. The benefit of qualitative research, you can obtain rich and detailed data, and you can uncover new ideas, understanding the context. For example, you explore what is the factors and barriers and motivators for certain health conditions. By using qualitative, maybe you use mixed methods, you can understand what actually the context, the why. From the questionnaire, you understand the what, and from qualitative, you understand the why it happens. And then you can also improve patient-centered care, because usually when we do research, we want to develop intervention, for examples, and from qualitative research, you can use the finding to actually tailor your intervention according to the needs of your patients. So research paradigm is an important topic, but it's quite complex. For quantitative, usually the research paradigm used in quantitative usually positivism, but the meaning of research paradigm is underlying set of belief and assumption that guide how researchers approach their studies. So why important to determine what is your research paradigm in qualitative research? Because it provides a foundation how you select your methods and how you analyze the data. And also it shape how you interpret your data, and also in what angles you will interpret your data. So how you choose your research paradigm, first is depends on your research questions and your focus of research. Sometimes you just want to develop new knowledge and you stop there. But sometimes you want to develop interventions. And so this determine what kind of research paradigm you want to choose for your qualitative research, and also what type of data available for you. For example, for rare disease, they are very rare of children with rare condition, for example. So what is more suitable research methods for this kind of data? But usually in master, we don't really go into in depth on research paradigms because it's quite complex. For example, in graduate theory, usually people doing PhD can go for this one. But I give you a shortcut. For example, for you doing your master, what is more practical for you? You can actually use descriptive qualitative approach. This actually use research pragmatism as your research paradigm. So the meaning of descriptive qualitative approach, it means to understand the who, what, where, and why of the experience in which the desired outcome is obtained, is to obtain rich data and accurate description of the studied phenomena. So using this approach, you can also produce rich data that is credible for your findings and also for publishables. Pragmatism means that you focus to understand the knowledge that is useful for action and change. And in health research, the pragmatic approach focuses on issues and usefulness of data that is actionable in real world setting. Because in healthcare, we usually do research to solve the problems. So, and at the same time, we didn't have much resource, money, and time to do research to go more conduct research paradigm that is really have a very in-depth theoretical underpinning such as quantitative theory. So we can use and choose pragmatic approach to do qualitative approach, to do qualitative research. So you can use this approach to develop health intervention and also to address important health disparity issues. So other important things to consider when doing qualitative research is to establish rigor. In other words, sometimes people use the words auditability, how your data is, how you ensure that your data is trusted by the reader. So that is if you see the tables here, there is many qualitative jargons, but usually the most common term that is used, usually for example, rapport. When you interview patient, how you develop rapport, how you develop trusting relationships so that they are more open up to share their experience and their honest views on some things. And then member checking, how you confirm that your finding is not biased, because member checking is the methods where you produce results and then you check your findings with your informants, which is for patient, for example, to confirm whether your findings is similar from what they mean when you interview them. And what is more feasible, for example, for if you're doing master and then you want to do qualitative research, the one way you can do to establish rigor is by using peer debriefing. So when you do your data analysis, you produce teams, for example, so you check with your supervisors and you discuss, and then your supervisor will critique your findings. Why you mean by this team, why you produce these teams, and then you have to justify with your finding. For example, you show your quotes from patients. So this is technique that you call it as peer debriefing. So you can explain this in a paragraph to tell your readers that actually your results are credible. And then purposeful sampling is the other this type of sampling that actually when you choose your sample, you choose the one that have which who have rich with informations, so that and when the data can be transferred with the same group of people with the same conditions, for example. The other things to also important to consider is reflexivity. Qualitative research often includes a description of reflexivity because in qualitative research, researcher is an instrument. Unlike in quantitative, your instrument is questionnaire kan. So for qualitative, researcher is an instrument. So in your research report, you should also include this description on what is your background and what is your way to minimize bias in your study. For example, your background is maybe when you are actually the clinicians and you are actually interview patients, and how you reveal yourself to patients and how you minimize your findings. Because when you describe your findings, when you say that okay, this is you also conduct peer debriefing so that your data have more credible to the reader. So there's a few data collection methods in qualitative. This is a quite busy slides. So the most commonly used in healthcare research are in-depth interviews, focus groups, observations, and sometimes people also conduct document analysis. But for in-depth interview, this means one-to-one semi-structured conversations, usually to explore experience, emotion, and motivations. It depends whether your participant is stakeholders or patients or clinicians. And the strength is it can obtain rich and detailed data and in-depth exploration of the individual experience. However, it's time intensive and requires skilled interviewer. So when you conduct interview, there is a method how you establish, develop your topic guide. And also there is when you ask question, there is also a skill how to ask questions to patients, and also what actually maybe the framework and theory that actually you use to develop your topic guide. For example, people didn't start with with theory. Sometimes people just start with research question, but this all depends on your research questions and research paradigm. The example of type of research that you use in that interview is, for example, exploring patient decision-making process regarding specific surgical procedure. The other methods is focus groups. This means by small group discussion facilitated by a researcher generating a broader range of perspective. This one group can consist as small as 3, ideally 5. 10 may be too big to control, but I think it depends also to the skill of the researcher who moderate the focus group discussions. The strength, it can explore diverse viewpoints of group dynamics and generate new ideas and experience. However, the moderator also need to have skill because sometimes some participant may dominate the discussions and maybe some are too shy to share their perspective. And then focus group sometimes, I think for those who are doing muscle surgery, focus group may be suitable for you. But it's depend on your questions because it's compared to in-depth interview, you can get only you can get 15 participants, maybe just 2-3 focus group interviews. Okay, so that you can in terms of time, is more feasible for you because in-depth interview you need to transcribe each interview, and then it requires a lot of time and money also lah. And then the other type of methodology is observations. It can be participant and non-participants. Participants means when you observe, you are part of the participant. For example, you are observing, you are a nurses, and then you observe the communication between doctors and patients, and then you are also the actor there. You are also a nurses who will facilitate maybe when doctor needs MCs or maybe the discussion, you also involved in the discussions. Non-participants means you just stay in one corner of the clinics and then didn't contribute and didn't interact with them. You just observe and make your notes. This is something that I conduct also before. Just to share with you, previously I did in-depth interview and participant observations lah, so that you can produce apart from the rich data, this can be used for triangulation, which is to increase the credibility of your findings. You use different types of methods to increase the credibility of your findings. So the example of this type of methods is observing a surgical team's communication dynamics and teamwork during procedure from a designated area. And then other things that can be used is document analysis. I know you have access to EMR. Sometimes people can can use this advantage to actually use document analysis part of your methods to strengthen your finding from the interview, for example, of focus group. So document analysis is mean by examining written, visual, or audio recordings to gain insight into healthcare experience, policies, practice, and historical context. The document that can use is, for example, medical records, policy documents, hospital reports, and sometimes for nowadays, people sometimes even analyze the social media posts. So it depends on your research questions and the feasibility to carry out the research. And then the limitations, document analysis is very weak to be used on its own. Usually you need to combine it with other methods, for example, focus group or interview. And all this, they have, if you go into details, all of this have their technique how to develop, for example, focus group topic guide is quite the same for in the interview. For participant observation, you also need to have a framework. What are the things you want to observe? And then for document analysis, you also need to have a framework. What kind of data you want to look for? And then data analysis. Data collection and data analysis process in qualitative research is non-linear. It doesn't mean that you need to interview until your all 15 participants, for example, and then you only that you do data analysis. It doesn't work that way, because when we do data analysis, we know how much number you need to interview usually through data saturations. You need to analyze your findings once you complete your interview, and then it happens together hand in hand. And then when you analyze the data and you think there's no new theme emerge, only then you think you discuss with your supervisor, for example, and everyone agreed that there's no new theme appeared, then it's time to stop. Then your numbers of participants can be concluded lah. Data analysis the definition is analyzing qualitative data is an iterative process that involves transforming raw data into meaningful insight. And to choose data analysis methods, it depends on your research questions, your type of data, and also your theoretical frameworks. Sometimes people start with theories. There is a theories that guide their research, for example, health belief models. So this is something you need to consider when you choose your type of data analysis. So this is the most common data analysis in qualitative research. There are thematic analysis, content analysis, grounded theory. So thematic analysis, the meaning for thematic analysis, identify, analyze, and interprets recurring patterns within qualitative data. The strength is flexible and adaptable to various research questions, and then it captured rich and detailed description of experience. However, it requires careful coding and interpretation to ensure teams accurately reflect the data, and in manner suitable for highly structured data. Thematic analysis, usually people analyzing the data. There's a false assumption about thematic analysis. Thematic analysis is not just a summary of domains. You need to really analyze into higher levels that what actually the team that holds all data together. So this is why you need to work more with another researcher. This is qualitative research cannot be done alone. From the context of student, for example, you need to work with your supervisors to doing data analysis and to ensure your codes really reflects what it means by the data, and then to ensure your analysis is enough to interpret your findings. Another type of data analysis is content analysis. content analysis is, if we see the spectrum, content analysis is quite towards quantitative analysis because it looks into frequencies and patterns of words, concepts, or topics. So it depends on what is your research question. If you didn't really aim to understand experience, for example, so content analysis may be enough for you to use for data analysis. Credit theory is the data analysis that aim to generate theories. So this is very quite complex. So this is something that I mentioned before, that usually people with PhD will able to do credit theory because it's really require time for you to really go through the process and to ensure theories are saturated. So how to present your qualitative findings? So this is example from my paper. So when you present your qualitative findings, what you should have at the back of your mind is, who are the readers? Who actually the one who you want to use your findings? So for example, when you interview patients, you want the clinician use the finding to maybe improve patient-centered care. So finding can be presented in using illustrative quotes, use the patient voice or excerpt from the field notes. You can also present in the tables and also figures. So by now, I hope you got an overview what is the benefit of qualitative research in healthcare, and it gives you in-depth understanding of patient experience and deeper insight in terms of, for example, healthcare interventions. And I would like to encourage you to use qualitative research. It can also produce more meaningful findings if you integrate qualitative research, because it's provide you more information on the context and maybe the social, and also uncover the social and cultural aspects of your research. And also, it's important to share your finding for relevant stakeholders so that your findings is usable and can benefit people, especially for patients, if you conduct your research for patients lah. This is the list of references. I think that's all. Thank you.
Okay, thanks, Dr. Hamizan, for the lecture. Can I get anybody that would like to ask Dr. Hamizan about, like, related to your research, or anything that you would like to direct the question to Dr. Hamizan? Yep, you can do so here. Okay, can I have show of hand who's doing a qualitative study here? Anybody? Or your plan, you plan to do, like, in the planning process? It is not an easy study, easy type of methodology, but a lot of meaningful data you can get from the your subjects. Because sometimes when we collect data, a lot of things that the deeper type of data we cannot get through our normal data collection, unless you do all these question, like qualitative of questionnaire, all that, then only you can get through. So not easy to conduct, but the skill is there. If you have any things that you would like to chat with Dr. Hamizan regards to the methodology, later probably you can talk to her. And because Dr. Hamizan is our staff here in Department of Surgery. Yeah, Dr. Shireen, Prof. Shireen, anything you want to ask? Yeah.
Yeah, actually, I just wanted Dr. Hamiza to reiterate a few of the common questions that I often hear with regards to qualitative methodology. So often people will ask, sample size, sample size, sample size. How do you determine your sample size? Very one of the most common questions that I hear. So you kind of covered it briefly just now, but maybe an emphasis on what sample size means in a qualitative methodology. And I think the other thing that I always hear regarding qualitative methodology is hypothesis testing. When we know that in qualitative methodology, because it is explorative, you're not actually testing a hypothesis because you are still in the midst of exploring before you even format a hypothesis. That's second, yeah. So first one is sample size, second is hypothesis. And third one, there's often a mix-up between surveys and questionnaires versus qualitative methodology via interviews. So surveys and questionnaires can be quantified if you assign scores and how many marks you get correct, etc. But through qualitative methodology cannot be quantified that way, right? So those few things, I wonder if you would help to reiterate to the audience today.
So first is about sample size. So we usually use published papers as a guide. First is what is your research approach? So different research approach have a different type of, usually we justify sample size based on what is approach that is usually published papers lah. So when it's descriptive qualitative approach that I mentioned in the presentation just now, it usually 25 to 30. And sometimes also we need also to consider you need to explore a bit what kind of journal you want to publish, because we also, yes, sample size is important, but we also need to consider what is publishable. Sometimes they didn't publisher didn't really look when your sample size is below than 10. So I would say more than 10. But I can really justify. You cannot answer, okay, you should have more than 10. So it's also, it actually depends on your approach. So qualitative descriptive usually 25 to 30, and grounded there's the numbers also. You need also to find, there's a text actually list out there what kind of numbers. But to really, for your research, what actually can determine your sample size is your findings, your data. So you only know how much your sample size only when you do the analysis. When this data is saturated, then it's enough. And then your other question is about
Mizan, just now you're talking about saturation, right? It depends on how many questions you are going to ask and how much of answer you get. Am I right? Because ultimately you need to categorize them according to some topics, or like let's say for the schematic analysis, right? Am I right? What do you mean by saturation of data or that?
So, okay, for example, your research question is about to identify factors that influence decision makings. And then you have your, from the teams, then it emerge. Certain thing, for example, the motivators, maybe children, parity, husband. And then when you interview more people, only only new, there's no new teams emerge. I mean, there's only the same answer you get. So from your codes, this is just a similar codes you produce. There's no other new codes that you found from your new, by adding new interview, didn't adding new codes from your findings, then means it's saturated already. Yeah. And then,
And
but
what
this is
about
something that you need to really
anything
discuss.
else that directly to this question, because sample size is very not fixed for quali, right? Am I right? Qualitative type of study. So that is the reason that Prof. Shireen want to know as well. But from what you mean is, it depends on the question that, interview and the content. And the more you get, but maximum normally people will get minimum of 25 to 30. And you will you have a look whether you still have a new theme or new content that can be add on, or else it's not going to not needed anymore if you want to increase further your sample size or your subjects for interview. What you mean is like that, right?
Yeah. And then I think
Not to get less than 10. What you mean is not to get less than 10 if possible.
Yeah.
Okay, all right. Yeah.
But I think the published
My
papers,
question.
it can be guided also by published papers lah. You see what numbers usually people interview, how many their interviews to produce their findings, and then you can guide your research.
Okay. What about the second question?
Second question, sorry, Prof. Shirin again.
Hypothesis testing.
There is, yes, there's no hypothesis testing, and
Yeah, sorry, I'm not really asking a question. It's because this is my experience having done qualitative work where people have asked me, hey, how come you don't have a hypothesis? Hey, how come you don't have a sample size? So as part of this talk today, I thought maybe you could emphasize how qualitative methodology differs from quantitative methodology when you actually, if you don't have a hypothesis, you cannot have a sample size calculation. And when you cannot have sample size calculation, you cannot do your study. But qualitative is actually quite opposite. You start off not really knowing how many, you have an estimate in your mind and you think you're going to get there by the time you finish that number, but you actually cannot predetermine to a fixed extent that sample size that you think you will need.
yeah, so in the qualitative study, you didn't start with hypothesis because this is exploratory type of research. For example, what I mean, when I present this in the slide in the beginning, that this is not positivism type of research design. So we explore things and lead to explore new ideas. So how we explore new ideas when, if we have some ideas in the beginning? So no, so we didn't have hypothesis in the beginning lah, in the qualitative research, because it's exploratory type of study.
Okay, can I get other question from our participants here? Students, do you want to ask further or any question that you or problem that you face if your study is regards to mixed mode or qualitative or that? No? Yep. So I think this method is not easy to conduct. Yeah, I think Prof. Shirin will agree with me. Yeah, this question. I mean, the research is very, very powerful because you can get a very good content, and then you can't really get it from the normal type of quantitative type of study lah. Yeah. So I would like to thank Dr. Hamizan for the great talk, and Prof. Shirin to supporting the today's talk as well. Yeah. So hope y'all try to attend most of the talk because they really give you a diversity in the methodology. At least you understand which one is the best for your study when you discuss with your lecturer and your supervisor. Yeah. Okay. Yeah.